Hi, my name is Sheira. I am a licensed acupuncturist in southwest London, Wimbledon and Putney to be exact. And I'm here to talk to you a little bit about acupuncture and the type of things that I would treat in clinic. Acupuncture is a branch of Chinese medicine. It is one of the four pillars, as we call it, which include Chinese herbal medicine, acupuncture, qigong, which are exercises for health, and diet. As an acupuncturist, I can suggest qigong exercises, and I also talk a lot about diet, but I'm not a herbalist. That is separate training in the UK. As a licensed acupuncturist, I have studied for 4 years for a university degree, and I have been in practice for 7 years. I've also done a 2-year diploma in pediatric acupuncture, so I treat from newborn all the way up. I've also done a pregnancy acupuncture training as a result of my fertility practice. A lot of my patients have become pregnant, and I needed to train, do some extra training so that I was able to treat them safely. I also am a volunteer weekly at the Royal Surrey County Hospital with the charity called the Fountain Centre, and I provide acupuncture for cancer support. So patients who are ongoing cancer treatment can have acupuncture to support them with side effects of their treatment. So that's another specialty of mine. And then I also deal with mental health conditions. So I treat a fairly wide range of patients. A lot of this has grown organically because of my location. I get a lot of fertility patients who then became pregnant. And then when they had children, they were looking for help with things like colic and eczema and constipation. And reached out to me, so I was able to help them with that because I had done the training, and then my volunteering role, and then as a result of those sort of things, the mental health came into it because I started to see a lot of patients for things like anxiety and stress and panic attacks. Depression is also a big one. And also people who are on long-term medication who's looking for support to help deal with the side effects of their medication and don't necessarily want to take more medications. They're required to take their medication long-term, but then obviously most medication has side effects, so we help with the side effects. Or people who are looking to come off medications if they're starting to wean and they need something that's supportive. So for example, when you were trying to quit smoking, some people will chew the gum, some people come for acupuncture because it helps to bridge that gap until your addiction has changed. Same thing with medication. You can't always come off of it right away, so you would need some support while you wean yourself off the medication. So that's one of the ways I have assisted people with mental health. I'm going to focus on mental health today because I think with our current situation that we're in the middle of a second lockdown, the pandemic is still raging, we have hope with the vaccine, but the reality is I think the situation is going to continue for a little while even with the vaccine. Because it's very new and we're all learning about it. So I think for a lot of people, being in cramped conditions with all the family has led to a lot of stress, anxiety. We're a bit more irritable with it. We are finding it difficult to sleep. And we're also in the depths of winter and the weather has not been great. So, depression and sad seasonal affective disorder is particularly hitting quite a few people badly. Now, acupuncture is, the easiest way I can describe it is it helps the body to find balance. So because we're not using chemicals and we're not a biochemical model, which is what medicine tends to be because we have the biology and then we put the chemicals in that affects the biology. Acupuncture, I believe, and this is supported by research that shows that it actually works on the level of physics. So where we have energy that's created by reactions, acupuncture is able to manipulate it. But it is also able to help in another way. It helps the body to find balance. It helps to get homeostasis, which is most of our chemical reactions that are happening. If there's too much salt in one area, then more liquid will come in, and vice versa. So it helps the body to achieve homeostasis. It helps it to get back that balance. And if we are feeling anxious or we are feeling overwhelmed, those emotions can flood us. We can feel unstable. We can feel just completely overwhelmed or submerged by these. And it can make it difficult for us to function in normal life. And what acupuncture does is it actually gives you the space and slows down those reactions, slows down those emotions, slow the thoughts down, that you're actually able to get on top of it. And a way I witnessed this, and it really brought it home, was in 2017, following the Grenfell fire. I was involved in setting up acupuncture clinics around the entire area. We had about 6 clinics going to help the residents who were coping in the aftermath of this fire, because the focus was on the survivors, but the residents weren't getting the help they needed as quickly as they did. And acupuncture is great because we didn't ask people to talk about their experience. We had them sit down, we put a few points in, and it made such a difference because people were actually able to stop grieving, and not stop grieving, but to get on top of those emotions in a way that was substantially visible. They felt better, they started to cope, they stopped crying. That overwhelming feeling is what acupuncture can really help with. And it just brings you down and gives you a little bit more clarity when everything is just too much. It's like a hurricane going on inside of you, and it's like the eye of the storm comes, and there's just that calm. I'm an integrated practitioner, so I do both TCM, which is traditional Chinese medicine, which is most of the physical stuff, as well as a 5-element practitioner. So I also look at emotional and mental health of my patients, and I can treat on that level. So if someone is having, maybe had a recent loss and that grief is overwhelming, they're not able to function, they're in bed all day, I can help with that emotion of grief. The body kicks in because we know that when we are feeling these emotions, a lot of hormones and steroids and corticosteroids are in the body at the same time. And research has shown that when you have acupuncture, things like adrenaline and corticosteroids are naturally lowered following your session. They don't know how it works, but they know it works. This is partly what it does. Just like how if I put a needle in, I can help lower blood pressure because we create a systemic reaction within the body. And I think for a lot of people who might be struggling to cope in this pandemic, things like acupuncture, it's not the only therapy that's out there. There's lots of talking therapies. There are things like reflexology, there's homeopathy, but I'm talking about acupuncture. And for a lot of people in this pandemic who are struggling, even if it's something that you can't quite put your finger on, I would suggest having a chat with someone, because you might find that little bit of extra support makes a difference, makes that family life a little bit more calmer, make you less reactive. You're not so quick to jump off the handle because the stresses aren't so much there. You can actually breathe a little bit better. As I was saying before, I'm a licensed acupuncturist, and I do like talking about acupuncture. It's a big topic for me. And so if anyone has any questions or would like to ask any questions, I am always available. Email works best. I'm going to put up a page where you can get my details. And if you're actually thinking about having acupuncture, I would always suggest looking at the British Acupuncture Council website. There's a handy little postcode tool there that helps you to find practitioners who are close by. And everyone that is a British Acupuncture Council member has been trained to degree standard. In the UK, we are not regulated, so anyone can call themselves an acupuncturist. So please make sure that your acupuncturist is trained to degree standard. That means that they're safe and you are safe, because there are very high standards we have to maintain in terms of PPE for personal protection to ensure that we're not transmitting anything. We're cleaning much better. And more often, to every patient, after every patient, I have to clean my room and I have to air it and I have to ventilate it. So these are all standards a British Acupuncture Council member would have to be adhering to. So, and if you have any other questions, I'm always happy to answer any questions. So it's nice meeting you, and good evening.